Hello, everyone. It's very nice to be talking to you today. And thank you, Sophie, for introducing me. So as you all know, I teach biomedical science, and my specialty is medical sciences. And I've chosen this topic today, antimicrobial resistance, for our talk today. I believe it's a very important issue, and you as future scientists, people who might work in the healthcare sector, I think it's very important that you are aware of the issue of antimicrobial resistance. So I'm just going to start my talk by highlighting that we are very lucky in this era that we benefit from modern medicine. We live in the era of modern medicine. And what this means for us is that we maybe no longer hear of diseases like cholera, like the plague. We can cure cancers. We can do organ transplants. We have done a lot of achievements. We can do complex surgeries. And this is all made possible because we managed to develop a lot of drugs, medicinal drugs that actually work and cure diseases. And one of the main categories of drugs that we have developed and have contributed to our current success in modern medicine is the antimicrobials. And because of these antimicrobials, we can now treat common infections, and we can do complex medical procedures without risk. And our talk today concentrates on antimicrobial resistance, and that is the issue when antimicrobials stop working. So bit by bit, we will introduce ourselves to the topic, and I will try to explain it in the simplest of ways. So the first thing, let's see what we mean by antimicrobials. Antimicrobials, these are substances that kill or stop the growth of microbes. So you can think of things like, for example, the detergents you use at home to clean your kitchen, to clean your bathroom. These are agents or substances, chemicals that can kill microbes. But the word antimicrobials specifically means four main categories of drugs that are used in medicine. And these are antibiotics. These are drugs that kill bacteria and are used to treat bacterial infections. And antiviral drugs, these are drugs that prevent viruses from growing and kill viruses. Antiparasitic drugs, and antifungal drugs. Because we have all these drugs now, which we call antimicrobials, we are capable of successfully treating a lot of infections, be it bacterial, viral, or parasitic. Antimicrobials, each one of these categories of drugs is very specific to the type of microorganisms it is developed for. So, for example, antibiotics only work in bacterial infections. So if someone has a viral infection, they should not take an antibiotic because it will not cure the virus. Again, if someone has a fungal infection, they need to take an antifungal drug. An antibiotic in this case is not going to work. In fact, if you use an antibiotic for a fungal infection, it might actually make it worse. So these drugs are very specific for their targets. So what is antimicrobial resistance then? It is when microorganisms throughout a period of time become change and become different to a point where they no longer respond to these medicines, which we call antimicrobials. And that's a very serious issue, that antimicrobial resistance. So how does it affect us as normal people, for example, when microorganisms develop this resistance to our arsenal of antimicrobials? It means simply that the everyday infections that people get and that are usually treated at home using a simple course of antibiotics, for example, or simple course of antifungal drugs, they become more difficult to treat. Patients who get these infections, like urinary tract infections, like simple sore throat or skin infection, they might need hospitalization. They might need clinicians to use more expensive drugs, combination of drugs to overcome these resistant microorganisms and the infections they cause. And of course, they can stay unwell longer. And as we all know, when the person takes a long time to recover, they can become infectious for a longer time, and that can encourage spreading disease to larger population and other patients. If we cannot treat these infections properly, that of course is bound to increase the death toll in the healthcare sector. Patients taking longer to recover means people are becoming less productive, so we can expect this to affect our economy as well if we have a spread of infections that are not easy to treat. Modern medicine as a whole is threatened by the rise of antimicrobial resistance. So as I said, nowadays we have cancer treatment, we do organ transplants, we can rescue preterm newborns, we have open heart surgeries. All of these procedures, these complex procedures, are made possible because we have effective antimicrobials. Patients undergoing these procedures are usually very vulnerable to infection. And one of the ways to maintain their safety is the fact that we have these effective antimicrobials that either prevent the infections from occurring in these patients, or if the infections occur, they are treated effectively. So antimicrobial resistance does not only affect the people who get infected, but also people undergoing other procedures like surgical procedures and so on. Antimicrobial resistance does not affect us individually, or it will not just affect people in like poor countries or rich countries. It will affect all of us, and it will have a global impact. So studies looking at antimicrobial resistance and how it might evolve in the next decades are giving us some alarming statistics. So it's, for example, predicted that in just over 30 years, the number of people dying from antimicrobial resistance will be more than people dying from diseases like cancer and diabetes. The death toll might reach up to 10 million deaths annually by 2050, just from antimicrobial resistance. And of course, the effect on the economy and the amount of money it's going to cost is enormous. So it's not just about the death toll that will occur in case antimicrobial resistance is left unchecked. It is also the worrying thing for us all is the fact that our arsenal of antimicrobial drugs is not only limited, but it is being eroded by the appearance of these resistant microorganisms. So if taking antibiotics, for example, which one of the main drugs for treating infections, if you look at the antibiotics were discovered and developed in the early 30s, and the era between the 50s and the 60s, that was like the golden age of antibiotics. So most of the antibiotics we use nowadays were actually developed in the 50s and 60s. But unfortunately, since 1984, we haven't seen new antibiotics coming into the market. So, and there are reasons for that. And this is one of the topics we want to discuss together at the end of this talk as to why we don't have new antibiotics coming into the market. But the fact of the matter is that we have limited drugs to treat infections, and the appearance of antimicrobial resistance is further limiting our weapons against microbes. So let's try to explain the science of how antimicrobial resistance develops. And I'm going to give here example using bacteria as an example. So in the majority of cases, and the usual kind of routine scenario is when you give an antibiotic, which is a drug that kills bacteria, to someone who has a bacterial infection, the usual scenario will be that all the bacteria will be killed by this antibiotic. And the person will recover, and they will completely recover and go back to normal, and the bacteria will be completely eradicated from their system. Unfortunately, with the misuse of antibiotics and the inappropriate use of antibiotics, antibiotic resistance will get a better chance to arise. So in the scenario of antibiotic resistance, when the patient receives an antibiotic for a bacterial infection, what will happen sometimes is that some of the bacteria will respond and die by the antibiotic. So that's the good scenario. But unfortunately, some of the bacteria, when faced with this stressful condition, which is that lethal drug, they will try to adapt to this harsh environment we have created for them. So they will adapt by mutating. So they will change their DNA structure so they can acquire new characteristics that will allow them to fight this harsh environment and to fight the antibiotic, for example. So these bacteria, unfortunately, that have mutated will not be killed by the antibiotic. They will divide and increase their number and pass on their resistance genes down to their progeny. And you will end up with a strain of bacteria that are resistant to your antibiotic. Okay, so this type of scenario is called vertical transfer from parent to progeny. The mutation is transported this way. So this is called vertical transfer. Usually this scenario takes decades for it to happen. And as we will talk later, it happens naturally in the environment. There is also another way through which bacteria can become resistant to antibiotics or acquire these resistance genes. And this is called horizontal transfer. So when you have a strain of bacteria, which is here represented by these yellow structures here, these yellow bacteria, and these are the drug-resistant ones. So they've acquired these mutations that rendered them resistant to a certain drug. These bacteria can transfer their resistance genes to other bacteria present in their environment. Other bacteria that might not be resistant, might be just commensal type of bacteria, which is a good type of bacteria, and render them all resistant as well. And that mode of transfer, guys, which is called horizontal gene transfer, is very common in bacteria, and it's one of the main mechanisms through which bacteria can become or can develop antibiotic resistance. So what do these mutations, or how do these mutations translate into survival benefit for this bacteria? So for example, a genetic mutation might mean that the new mutated gene would code for a cell membrane protein that is impermeable to your drug. So the old protein allowed the antibiotic or the antimicrobial to actually enter the cell. Now the new mutated protein does not allow the entry of the drug. And that's right from the start. The drug cannot enter the cell. It cannot do its job. It cannot kill the bacteria. Another way the mutation might mean or might translate into a change in a target. So most of the drug we develop work on some target inside the cell. So if the mutation means that the target's shape, for example, is changed, it means that your drug, even if it enters the cell, it will not be able to identify its target, and hence it will not work. Another thing can happen. The mutation might lead to the formation of an enzyme that is actually capable of destroying the drug. So the drug enters the cell, the bacterial cell, but it's quickly destroyed by this new enzyme, and hence it will not be able to meet its target or do its job. A final way that can sometimes happen is the mutation might mean or might lead to enhancement of the expression of what we call efflux pumps. And these efflux pumps, these are like ducts that go through the cell membrane of bacteria, and they're naturally present there in bacterial cells. And the job of these efflux pumps is to pump out toxins from inside the bacterium. And when sometimes, as I said, the mutation will mean that you have a lot of more than usual of these efflux pumps. And what these efflux pumps do is the antibiotic goes in and then it's pumped out quickly out of the cell again. So that is another way of circumventing the effects of the antibiotic. So as you can see, if we are clever as humans and we have invented antimicrobials, microbes are also clever. And they develop ways to circumvent all of our lethal drugs. And sometimes for bacteria, for example, they can develop resistance not just against one drug, but against multiple drugs. And these types of bacteria are usually called superbugs. So in here, sorry about the messy slide, but it is the life story of one of these superbugs. As you can see, it's a long life story, but it actually evolved very quickly. in the last couple of decades. So that gives you an idea about how important it is for us to talk about the rise of these superbugs. So the term superbug was actually coined by the media to describe one of the most known superbugs, which is the MRSA. Probably you've heard about it, which is the methicillin resistant Staphylococcus aureus. This is a type of bacterium that developed resistance to antibiotics. MRSA came into the media and came into attention. It was actually discovered back in the 60s when we saw the first cases of MRSA, and that was in the UK. So the first cases were discovered back in the 60s, and they appeared in the setting of hospitals. They appeared in healthcare settings, so hospitals mainly, where people started seeing this type of resistant bacterium. The bacterium itself is called Staphylococcus aureus, and it's resistant against an antibiotic called methicillin. However, the MRSA did not become a serious clinical problem until the 80s and the 90s, when doctors started to, and healthcare practitioners started to notice that more and more patients are getting these infections in the hospital and clinical setting. And that was a problem because this microorganism did not respond to the usual antibiotics that we used against Staphylococcus aureus. However, for a while, we found out that another antibiotic can actually work against this resistant MRSA microorganism, and that was vancomycin. But before we managed to take a deep sigh of relief, unfortunately, MRSA developed resistance against vancomycin as well. And that resulted in another strain called the vancomycin-resistant Staphylococcus aureus, or VRSA. MRSA started, as I said, in the clinical settings, confined to clinical settings. So clinicians saw the infection in hospitalized patients. Unfortunately, later on, it became community-acquired infection, meaning that the bacterium can be transferred between healthy people in the community. So that's even more concerning now. So it's not confined to a certain place now. It now can be transported anywhere. And hence the classification of MRSA changed into two types of the organism, the community-associated MRSA and the healthcare-associated MRSA. Mostly community-associated MRSA causes skin infections. But later on, we discovered that a particular strain of community MRSA can also cause a severe type of chest infection or pneumonia. And this was in particular very concerning. And ever since we discovered that this can occur, it has been under intense investigation by scientists and health authorities. If you remember back when I was talking about how the resistance genes can develop through mutations, and we said that these genes can be propagated vertically from the parent to its progeny, but it can, we also mentioned something about the horizontal transfer. And unfortunately, this has happened with the MRSA, which managed to horizontally pass its resistance genes to another bacterium called Enterococcus faecalis. So that Enterococcus faecalis became also resistant to vancomycin. And it has now its own clinical problems. So as you can see, the life of a superbug is complex. It evolves quickly. So in a couple of decades, we have now, instead of just one type of bacterium, we have different strains. We have other type of bacteria also affected. And the resistance is not just against one of our antibiotics, but against two types of antibiotics. So now I think by looking at this life story of the MRSA, we can really appreciate how important it is for us to take notice of antimicrobial resistance and do something about it. So why is antimicrobial resistance increasing, or why is it appearing in the first place? Well, antimicrobial resistance, guys, is a natural occurrence. It's part of evolution. When a microorganism is subjected to something that is lethal to it, or that threatens its existence, it will somehow, over a very long period of time, try to adapt to this harsh environment and develop resistance to the drug that is lethal to it. And this, however, occurs over a very long period of time. So it takes decades for it to, for this kind of evolution to occur. The problem, what we are concerned about is that it's happening fast. We're doing something wrong as humans that is making it happen faster than usual. And one of the main errors that we're doing is the misuse and overuse of antimicrobial drugs. That is one of the main things that we're basically, especially when it comes to antibiotics, using a lot of antibiotics in the medical profession, in the agriculture profession, and by overusing them and misusing them, we are encouraging the resistance to develop much quicker. Another thing is the lack of infection, proper infection and disease control. And that encourages infections to spread, whether we have treatment for them or not. That's another issue, but we should not encourage infections to spread. So the two main things is the lack of hygiene and the misuse of the drugs. And knowing that is very important, because as we know this, we can now put plans to improve our behavior regarding these two issues. So let's see exactly what can be done. Antimicrobial resistance, as I said, is not something that will affect only one country or one part of a country or one population. When it spreads, it will affect everybody. It's actually now affecting everybody. There is evidence in the majority of countries on Earth that we have antimicrobial resistance. So the action we need to do needs to be coordinated across countries, rich countries, poor countries, east, west. Everyone needs to be involved in the process of avoiding antimicrobial resistance. And of course, the main initiative taken is by the World Health Organization, which is as a leading organization for global health management, have taken action to address the problem of antimicrobial resistance. So in 2015, the WHO developed the Global Action Plan, which directs the management of new laws and new changes across countries to make sure that antimicrobial resistance is under control. The WHO is not working alone. It's working with other organizations like the Food and Agriculture Organization of the United Nations, the World Organization for Animal Health, because as I said, it is not just humans who are affected by antimicrobial resistance. Animals, plants, our food chain is also affected by the antimicrobial resistance. Under guidance from the WHO, lots of countries, including third world countries, have developed plans to work against the development of antimicrobial resistance by increasing awareness of their people, by educating healthcare workers, doctors and nurses about antimicrobial resistance, by changing the laws so it becomes more difficult for people to acquire drugs like antibiotics or antifungals without prescription. It's not an easy job to implement new laws. It is very important that all countries are involved, not just the developed countries, not just us here in the West. Everybody needs to be involved in the changes. Because the problem, as I said, is shared. So if you look at a country like India, for example, the majority, or about 80% of the global consumption of antibiotics is actually in India. So, as I said, it has to be a global approach. Here in the UK, the government has set a 5-year plan to tackle antimicrobial resistance. And the main targets of this plan is to reduce the use of antimicrobials in humans. So you'll find now that doctors are more reluctant to prescribe antibiotics than before. We also plan to reduce antibiotic use in the food industry, especially in food producing animals. And that is actually one of the main sectors where antibiotics are used and abused in the agricultural sector. Antibiotics are extensively used in breeding chickens, beef, cows, and all these animals for food. And they're not used to treat infections, unfortunately. They're used for protection, which is called prophylaxis. And they're used to increase the productivity of the animal, so the animal is bigger and more productive. And that needs to stop because it is driving antimicrobial resistance into our food chain. The government has also put target to decrease infections in general in healthcare settings, so in hospitals and in clinics. So now you see these disinfected stations with disinfectants. Doctors now are more vigilant about disinfecting their hands and their instruments between patients. So this is all to reduce the use of antibiotics, use them correctly when needed, and improve hygiene so we, in general, reduce the risk of developing infections. I'm going to stop talking now, and hopefully I have given you a quick idea about why we all need to be concerned and learn about antibiotic or antimicrobial resistance. And I'm hoping you guys can start maybe giving you your opinions, and maybe start by letting me know, before our little talk today, has anybody heard about antimicrobial resistance? Have you heard about MRSA before? Where did you hear about it? And how do you think we should increase awareness? I'm going to stop in my show. And yes, I am here to, let's start talking about, do people know about antimicrobial resistance?
We've got one question from somebody asking, would you say that AMR is potentially a direct result of mass animal farming?
Absolutely. We have put profit above a lot of things, and farmers will do anything to get profit from their animals, and that have contributed to this abuse of antibiotics, in specific antibiotics. I think, yeah, that's a major issue.
And then another question, I think, in regards to like prevention, do scientists test for like antimicrobial resistance in certain viruses, or do they predict that there may be AMR taking place?
Yes, absolutely. For a lot of infections now, when a patient comes with, like, say, skin infection, and the doctors suspect that this might be a resistant strain, they will do tests to detect the resistance. They will do it at an early stage of the patient's management, because it is important, if you detect the resistance, to manage it very quickly, to avoid, of course, the microorganism propagating, or the patient outcome worsens. Yes, we do test for that. And
thank you. We've got another question.
Yeah.
So it says, once AMR has occurred, are there any solutions, or will the person/animal have to live with it?
Once it has occurred, so we have antimicrobial resistant microorganisms out there. That is a reality. We have it out there. If it's in the environment, which it is, because these resistant microorganisms are present everywhere. So you can find them in the soil, in the water system. They can eventually move into the food chain, and infect humans. So it is there. How we can prevent them from happening, or from causing more disease, is by improving our hygiene, for example. So at the individual level, we can be more careful about hygiene. How do you think, guys, we can improve our hygiene as individuals? How do you think we can prevent AMR from happening? I mean, I don't want to give an answer. Maybe you can think about it. What do you think you should do as an individual, or as someone who, say, working in the healthcare setting, or someone who is in the decision-making position? What would you do to prevent AMR?
Would it be things like regular hand washing?
Absolutely. So things as simple as that. Anything else?
I think we've got another question separate from that, but in terms of what we're seeing from like COVID-19 and the way that viruses are becoming resistant, would we take some of like the things that we've been kind of told from that and apply it to other situations?
Absolutely. I mean, COVID has taught us in a very practical way that infections, very simple infections, can spread They can bring the world to a halt. They can cause death, uncontrollable. And we should take this lesson from COVID. I mean, COVID was just one virus. Yeah, it kept on mutating, and that gave us a problem. But imagine if it's as well multiple types of bacteria developing these resistant and becoming basically incurable infections. That can happen. And a lot of people think of antimicrobial resistance as a slow type of pandemic. And unless we do something now, which we are, it's not a bleak picture, guys, we are doing something to stop it. But if left unchecked, it will become a pandemic and it will cause death. As to how we benefit from COVID, I mean, everyone now, it's become a habit for everyone, for example, to wear a mask. I'm still wearing a mask. If you don't want to wear a mask, it's become a habit for us to wash our hands more regularly. So yes, these are things we need to keep in place because hygiene and preventing the infection from occurring in the first place is basically the best way to combat infection, is to prevent it from happening in the first place. And you cannot imagine how simple it is to prevent an infection. It's just washing your hands, making sure, for example, if you have a cold, that you dispose of your tissues properly. If you know of someone, your friend, for example, is not well, don't go and visit and get yourself infected. Practice safe sex, for example, to prevent propagation of bacteria and infections. A lot of simple measures can be done to prevent a major issue that can affect all of us. Currently, we do have these resistant bacteria, but we've been managing these bacteria by the drugs we have. But as we saw with the MRSA, every time we try to tackle a resistant bacterium with another antibiotic, for example, it becomes resistant eventually to this bacterium. So the best thing is to try to avoid getting infected in the first place. And that will give us some time for research and for scientists to develop new drugs and new techniques to tackle these microorganisms.
So, following on from that person's question around whether someone would have to, or the person or animal would have to live with it, if they found that, for example, they were experiencing AMR, would they then try a different antimicrobial drug to see whether that supported in tackling the issue? And then once you've exhausted the list, but obviously there's quite a lot to kind of get through, then that's when you realize that the virus is very much resistant to the drugs that it's being given.
Absolutely. I mean, what doctors would do now, if a patient, for example, goes into hospital to do a surgical procedure or whatever, and they get infected with something like MRSA, what they will do is they will try a combination of drugs, which are more powerful drugs, more expensive type of drugs. And these usually kind of manage the infection and the patient will recover. But the problem is a lot of the patients that get these types of infections now are vulnerable patients. So mainly patients who have their immune system is compromised, or because they have a chronic disease, for example, or the elderly patients. So even though we still can control these microorganisms with aggressive courses of treatment, sometimes the condition of the patient does not allow the clinicians to go aggressive with the treatment. And unfortunately, that can mean increase in the risk of death for some patients. So we have to be careful in controlling that these infections do not spread into hospitals in the first place or in the community.
Thank you. We've got one other question around how often antibiotics are discovered. I think you said in your presentation that we haven't discovered anything for a long time.
Yeah.
So yeah, it would be nice to expand on that if possible.
Yeah, so guys, The first antibiotic, maybe let me tell you a little bit of history. The first antibiotic was, of course, penicillin, was discovered by Alexander Fleming in 1928. And following that, in the 40s and 50s and the 60s, the development of antibiotics by pharmaceutical companies was really active. And most of the antibiotics we use nowadays were discovered during that era. But the problem is that, as I said, since the late 80s, that has changed, and not a lot of new antibiotics have come into the market, if any. And this is because when a pharmaceutical company develops antibiotics, this is a very expensive thing to develop. It's an expensive drug to develop. It takes years and years to develop one type of antibiotic. And it costs billions of pounds to finally make a drug make it to the market. On the other hand, if you're a company, think about it, if you are a company that is making a product, at the end of the day, the antibiotic is a product, you want to have money in return. So you want to sell your product and get money in return to compensate for the amount of money that you have already spent on the development. So you want to make profit as a company. Unfortunately, antibiotics, because of the very limited use, I mean, antibiotics in medicine are used under strict conditions. They're used usually for short time. They're not usually prescribed for long periods. And they're very effective drugs. So once you give the patient like 7 days of antibiotics, that's it, it will work. So the consumption here is not much. So the companies, unfortunately, do not get the profits they hope for. And unfortunately, in the past decade, a few companies, especially the small ones, that tried to develop antibiotics have gone into bankruptcy because they couldn't get the profits. Any company, whatever it is, it will look for profit. They're not charities, okay? So that brings us to the point that governments here have to support research and development of antibiotics and antimicrobials in general. It should not be left for the market to control how we develop these drugs. It has to be something pushed in by the government. And this is what the governments across many countries now are doing. They're pouring in a lot of money into antibiotic research. And that's what's happening here in the UK. And the UK is not just pushing antibiotic research in the UK itself, but also in other countries and for the benefit of the poor countries. Because as we said, and as we learned from COVID, we're not well until we are all safe and well. Okay, so that's why we have not developed much antibiotics, because they're not profitable. Think about it, for example, if somebody has diabetes or if they have asthma, these patients take the drugs on daily basis. So it's more profitable for a pharmaceutical company, for example, to develop a drug for diabetes or a drug for asthma, because it will be taken every day by the patient. There will be consumption, there will be profit. That doesn't happen with antibiotics, unfortunately.
Brilliant, thank you. There's one last question, unless anyone else wants to add one in. Oh, we've got another one coming through, that's good. So is there a possibility of someday things like viruses becoming resistant to our treatments entirely? Viruses are some of the most difficult infections to treat because they mutate very quickly, much quicker than the bacteria do. Currently, the type of antivirals drugs we have their limitations. Many of the drugs, antiviral drugs developed and present in the market now tackle certain types of
viruses. So they're very specific in a way. And that's in contrast to something like antibiotics. So some antibiotics are what we call broad spectrum. So they act against different types of bacteria. But for antivirals, they're kind of more specific. There is the issue of mutation, that the virus changes, and we've seen that with the COVID. So developing drugs against the virus or vaccines against the virus, again, is subject to those mutations occurring. So yes, our success in antimicrobials against bacteria, so antibiotics are, let's say, are more effective than antiviral drugs. And for a lot of viruses, unfortunately, we still do not have effective drugs. So the arsenal of antivirals we have now did not work very well for COVID or for Ebola virus, for example. So it's not as effective as antibiotics.
Great, thank you. We've got one more question. So how much research would you say is needed for a new antibiotic before it goes on trials on humans?
It can take years, guys. Maybe something ranging from 20 years or so to for something to actually go into the market and become allowed to be used for humans. Because the process of developing a new drug is very lengthy. It starts by just trying to find an active kind of substance, which is usually derived from something natural, like from a plant or a natural source. And then these are tested in the lab, and that alone, just screening those compounds and whether they're effective or not, can take years just being in the lab. And then it moves into another stage of testing on animals, and then it goes into testing on humans, and all the clinical trials we've all have become familiar with during the COVID. Under normal circumstances, these trials can take years before the drug is actually approved to be used in the market. So we're talking about 20 years or so of research and development for a drug to come to the market.
Wonderful, thank you. We haven't got any more questions, so we can end it there if nobody's got anything else to ask. If you do, now is your time to ask some questions. Otherwise, thank you for joining us today. There will be an opportunity for you to watch this back. This is on demand, so you can click the Zoom link that you had already, and you will be getting a video sent to you next week. So you can watch it back and hear all about this great and fascinating subject again. So thank you very much, Garda. We really appreciate it. Yeah, I will sign off. Have a wonderful evening, everybody, and thank you for joining us.
Thank you, everybody, and it's been great talking to you. Thank you.